Hey there, my name is Dr. Carl Baird, and today I'm going to be taking you through your level 1 workout for knee pain. So before we get started, I just wanted to discuss a little bit of the philosophy of what we're trying to accomplish here. And so what I really try to do for a lot of patients is really just simplify the cause of their pain. Again, a lot of people come to me and they're confused because they just have this knee pain. They don't know when it started. They can't really tell you how long it's been there, a few weeks, a few months, a few years. They don't really know. And so it causes a lot of confusion about like what actually caused it. It wasn't a fall down the stairs. You weren't tackled playing football. It's just this knee pain that all of a sudden has become part of your life. And the cause of that, in its simplest terms, is that there's too much impact going through your knee over too long a period of time, that eventually your body and your brain says, hey, here's some pain at your knee to keep you from using that. So the purpose of this workout is to teach you how to limit the impact that goes through your knee. We do that through improving movement patterns. We do that through improving mobility. We do that through building strength, by far the most important. And so what you're not going to find in this workout are rehab exercises for patellar tendonitis, meniscus, ACL, PCL, nothing like that. But what you're going to learn are what you need to be doing to build good movement patterns, to improve your mobility, and most importantly, build strength to limit the impact that goes through your knee. And if you're consistent with this and you follow it from level 1 to level 2 to level 3 to level 4, what you'll find is that eventually that pain is going to go away because you've managed to successfully limit the impact that's going through that joint. So that's what we're trying to accomplish. And without me blabbering on anymore, we'll go ahead and get started. The things that you're going to need for this workout, this is level 1, introductory, but we are going to use a couple blocks or a step up. We're going to be doing step up. So anything that's about 8 to 12 inches to step up on, we use those yoga blocks. And I like a medium weight. So if you have a medium weight, grab that. You can get creative. Grab a gallon of water, anything that you have around the house that you're going to be able to hold right in front of you here. And the other thing that's nice to have, we're going to use a stool, but a chair or a bench of some sort for our box squats. We're going to be doing box squats, so we need something to reach down to. All right, so if you're ready to get started, let's do it. We are going to start on our hands and knees. Do a quick little warm up here. Nothing crazy for our level 1. We're going to do a cat-cow. So hands, knees, cat position. We're going to press through our hands, let the head hang, and tuck your pelvis in. Good. And then the cow position is the opposite. You're going to rock that pelvis back and lift your head up. So all we're trying to do is just warm up the joints of our spine, get some movement in there, get us ready for a workout. So again, just slow and controlled, whatever feels good. If you want to shift to the right, shift to the left, really just find wherever you're tight as you work through this movement. Good. Okay, next we're going to shift into a lunge position. And so this is going to be our hip flexor stretch. We're going to start trying to loosen up our hip flexor a bit. So for this one, all we're going to do in this lunge position is go ahead and lean forward. And again, we want to feel the stretch on the front side of this back leg. And then we're going to back off just a tiny bit. So the first 30 seconds of this movement are just going to kind of ease yourself into that position. You don't want to go from 0 to 100 with this stretch. You just want to slowly ease yourself into the position. Each time you try to sink a little bit further into it until on this one, good, we're going to hold. And so for the last 30 seconds, we are going to hold this position. Really try to keep your trunk in a nice straight line. We want to really feel that stretch on the front side of that back hip. This is our hip flexor muscle. Really important to loosen up. It gets tight, feels tight a lot of times just because we sit so much. All right, good. We're going to go ahead and switch sides. Gonna do the same thing on the other side. So again, we're gonna spend the first 30 seconds slowly sinking into that work, or into that position. We want to feel that stretch on the back side, front side of the back leg. Good. Last one, and now we're going to hold it. And again, we really want to be feeling that stretch on the front side of our back leg. We're going to hold it for the last 30 seconds. Again, this is just one of those muscles sitting a long period of time, can feel really tight. If our low back stabilizers aren't working the way they should, the hip flexor is forced to work a lot harder, which gives it that sensation of tightness. So we want to try to loosen it up. Good. Okay, then we're going to stand up and do a side lunge hip mobilization. So more stretching on the hips. We're going to start with our feet wide, toes pointed out about 45 degrees. We're going to do a side lunge, so we're going to bend to the right. Good. And then back to the top. Bend to the left. Oh man, I'm tight today. Good. Back to the top. So again, you can really feel the stretch on the hamstring groin muscle of the straight leg, or if you want more of a hip stretch, you can really try to sink your hips lower to the heels down here. You feel that stretch more in the hip joint. So again, no right or wrong, it's just wherever you feel tighter. Good, you can start to really get into a groove, really move back and forth as you start to loosen up. Try to take your hands off your thighs there. And should be starting to feel pretty warm. All right, great. Okay, next, we're moving into the strength training part. So we're gonna start on our back for this one, and we're gonna do glute bridges. So glute bridges, hands out at 45, feet brought towards your hips, and then you're gonna press through your heels and bring those hips straight up. So one thing you need to know about knee pain is that the movement down at your knee is mostly controlled by your hip musculature. So if our hips are weak, our glutes are weak, that's when you're going to get that knee kind of caving inward, which again, too much impact over too long a period of time, you're going to start to get pain. So building strength in your glutes, building strength in your hamstrings is a must when you're treating knee pain. We like the bridge just because it's safe and very effective. Good. Got 5 more seconds. And done. All right. Next, we're going to move on to our side. What we're going to do is called the clamshell. So on our side, you can rest your head on your arm like this, knees slightly out in front, heels stacked, and you're going to just lift your leg up. Good. So main thing with this one, pretty easy. Just make sure you keep that movement at your hips. So some people, they try to open up so wide that they kind of twist their whole back there. We just want to really keep it in our hips, even if that means we don't go quite as far. And then what you want to start feeling is a burn on the outside of the hip here. This is your glute med muscle. When I talked about that knee kind of caving inward, knee valgus is what it's called. You've probably maybe seen or heard of that term before, but that's controlled by your glute med muscles, which is why for knee pain, limit the impact that goes through your knee. One of the most important movements to strengthen. Good. Keep going. Again, should feel a pretty good burn. And good. You're gonna switch sides. Same thing. You can rest your head on your arm, knees slightly out in front, hips, knees, ankles stacked, and you're opening up. Good. It's also called what? The Jane Fonda? Isn't that the 80s infomercial girl had you doing these babies? They were called the Jane Fonda. I actually saw a picture of her recently. She looks good for, I think she's like 70 now. It's crazy, but in really great shape. So obviously these work. So we're gonna keep doing them. Nice. Oh, we got about 15 seconds left. Again, should feel a good burn. Don't open up so far that you're twisting at the low back. Really keep it in your hips. Again, the goal of level 1, we want to keep it safe. We want to start building strength, but we really want it to be safe, because if you have knee pain and you just move to an exercise that's too advanced or start doing something crazy that you saw on Instagram, that's how you're going to re-injure yourself. So it's important to start at level 1, build a strong foundation, and build up. That's what we want. Good. All right, moving on to our standing. Next, we're gonna do toe taps. So main thing with toe taps is that we don't want our knee locked out. So you're gonna have a slightly bent knee. I'll start on my left, and then all you're gonna do, you're gonna tap in front, back to the middle, tap to the side, back to the middle, and then tap straight back. Good. So really this is the whole movement. Again, when we're just really tapping, so I'm not kind of like resetting like that. I'm really trying, the longer I can balance on this leg, the more challenging this workout is gonna be. And again, this is another one, you're gonna start to feel that burn in the glute med, but it's also really good for balance, really good for control. But this is kind of what I was mentioning earlier, is that we need to be able to support ourselves on one leg, because if we're not, what happens, again, that's when you get your kind of knee caving inward like that, right? And that's where, again, and it's like these micro traumas, you might not notice it right away, but if you're a runner, walker, hiker, the more miles you put on that, the more you're gonna get into trouble. All right, good. Let's go ahead, switch to the other side. So now we're gonna be right side, slightly bent knee, and we're just gonna tap in front, tap to the middle, tap back, same thing. So again, the longer we can balance, the better. If you do fall out, it's okay. Just kind of reset and get yourself right back into it. But again, we're working on building strength in this single leg stance. You'll probably, where you'll feel it is going to be the outside of that hip. Again, that's your glute med muscle, but that's the one that controls that movement. So we really want to make sure we've got this down. Nice work. 15 seconds left. Really try to balance. Again, slow and controlled. It's not how fast you can go. That's when people start losing the balance. I'd rather have you balance for this whole period of time than try to get so many reps that you fall over. All right, good. Next, we're gonna use that kettlebell that I talked about. Where'd I put it? Okay, so this is gonna be our kettlebell march. So this is gonna be our carry variation. I love carries, really good functional core strength. This one's gonna incorporate a little bit of balance into it, which is part of the reason I really like it. So if you have a medium weight, this one is one where a little bit heavier weight is good, as long as you're not carrying the weight like this, right? You don't want kind of your skeleton to be holding you up. You wanna make sure you're standing nice and straight, and then all you're gonna do is march in place with a quick second hold at the top, just enough for that balance to kick in. Good. You're going to bring your hip to 90. Keep your knee bent to 90. Try to keep your ankle up. It's just going to create a little bit of tension, which is what we want. And again, you're just holding it just enough to get that balance to kick in. You can almost feel it in your ankle. I don't know if you saw mine. It kind of rolled in, right? That's what I mean. Like, balance just has to kick in. All right. Good. Next, we are moving into our movement pattern. So we're going to start with the hip hinge, which I will demonstrate here. We're going to start no weight. Again, remember, this is level 1. This is just all about this introductory learning these movements before we add a bunch of weight to it. So if you just started adding weight to this movement and you're not doing it right, you might make your knee pain worse. You might start to have back pain. So we're not going to have any weight. We're going to start loose knees, and then we're going to just reach our hips back, stopping when we feel tension in the hamstrings right there. Good. So let's just do a minute of these hinges. Again, this is a new term for you. I'll leave a couple links down below, but if we're talking about limiting impact through our joints, whether that's our knees, whether that's our back, neck, the hinge is one you gotta understand. Not only because it'll limit impact on your knees, but it's kind of the foundation for so many other movements that you're gonna do as you get into the strength training world, that you really wanna make sure you have it down. For this first round, again, we just wanna keep those loose knees. And again, the movement is reaching the hips back. That's a common mistake that people have, is they kind of squat them. It's not a squat. It's reaching the hips back. So again, I allow my knees to bend, but I don't actively bend them like a squat. Good. Keep going. And done. Good. Next, we're gonna do what's called a box squat. So grab your bench, grab your chair, and all it's gonna be is a squat. So we're gonna reach our hips back and then bring them down just for a quick tap and back up. Good. So again, squat, another one of those movements. You really wanna make sure you have the basics down before you start adding a bunch of weight to it, because that's how people get hurt. They try to do too much too fast. So the box squat's nice because it gives you something to reach towards, and again, it stops you before you sink too low. So the movement itself, pretty straightforward. Just make sure that that first movement is sending your knees back and then dropping them down. Especially for knee pain, what we don't want are those knee squats where, again, you unlock at your knees versus unlocking at your hips. To limit the impact on your knees, we're going to teach you to unlock at the hips. So you can see at the top or at the bottom how my shins are relatively straight and they're not kind of bent like that, which again puts a lot of tension on those your knee. Great. Okay, next we're going to move into our step up. So this is where I'm going to use these yoga blocks, but you're going to grab anything you can step up on, bench or but going to be pretty easy. Main thing, we're going to do single leg step up. So we're going to start with the side on the block, and I want you to press through this top foot. Good. And so this is going to be the movement itself. What you want to avoid is that toe off, right? So a lot of times if you have knee pain, some people try to their bodies are smart and they'll try to compensate and they'll actually use this back foot to come up, and that's how you'll get up. That's not what we want. We want to build strength in this top leg. Good. So the other thing you want to avoid that I've seen people do when we teach this movement is kind of like a rocking side to side. So this movement we want straight up and down. Pressing up off the top leg. Just got a few more here. And done. Good. Gonna move on to the other leg. Okay, so now other leg on top. Again, we're pressing up off the leg that's on the bench. We're not gonna be pressing off the back toe like that. So you're gonna press up and back down. The other thing that can happen that sometimes is interesting, if you are having pain with this movement, it doesn't always mean that you're doing damage to it. So sometimes people have been in pain for so long that their body or their brain kind of sends that pain signaling down to protect them, right? But when you're doing a movement like this that's totally safe, we're not doing any damage down there. The brain is just nervous, right? Because it's used to having an injury down there. So a lot of times what I tell people, if they're having pain, I mean, start with one block, but still do the movement and kind of work through the pain, even if it's painful. Because again, the movement itself is a safe movement. We're not doing anything that is going to hurt it. All right, good. All right, so we'll take a quick little break, and then we're going to do one more round of that. So again, kind of catch your breath, grab some water, take a few deep breaths, and when you're ready, we'll start on round 2. I'll show you a few ways to make these a little bit harder if you want. So back to our glute bridges. So this is one to make a little bit harder. You can make bridges pretty hard. You're going to do arms out at 45, but this time really press your palms into the ground. So again, that's going to create a lot of tension in this upper body. And then while you're pressing those arms down, press up. And so again, at the very top, you're squeezing those glutes, and it's almost like you got this full body tension, which again, the more tension we can create in our muscles, the less force goes through our joints. We want our muscles to be the ones taking the brunt of everything we do, and teaching them how to take tension or create tension is going to be good. Good. Again, make sure you're squeezing at the top. Playing around with your foot positioning. Main thing, you don't want to go too far out. You're really going to feel it in the hamstrings. You might start to feel that in the low back. If you go too far in, you might start to feel that pull along the front there. Good. One last one. All right. Back to our clamshell. So if you wanted to make this harder, you can get a little mini band and put that mini band around your knees right there. Just add a little bit of resistance to it. But again, you don't need to. This is one of those ones that even without a band is still pretty difficult to do. All right. The Jane Fonda. Just need my leotard. Neon leotard. Good. Again, making sure you're not lifting up so far that you're rotating at the spine there. Keeping the heels stacked. Keeping those hips stacked. You noticing a little harder second time through? The burn feels a little bit more. Feeling that burn a bit more? Nice. 10 seconds. All right. Good. And we're going to switch. All right, here we go. Same thing. On to the left. Keeping the heels stacked. Hip stacked. Opening up that knee. And again, Strengthening that glute med for knee pain. If you're going to target one muscle, which I usually don't try to get people to target a muscle, it's more about the movements. But for knee pain, if you're going to target one muscle, glute med, glute max, the hip complex, controls all your knee movement. So you're going to want to build strength in there to control that. Nice work. 20 more seconds. Other things to pay attention to are, do you feel a difference side to side? Is one side harder than the other? We work with a lot of people who, previously have had major surgeries, ACLs, years ago. But what you'll find is that they still have that imbalance. One side feels way harder than the other. So really pay attention to how you're feeling. All right, good. Back to our toe taps. Standing on up. Again, loose knee. So again, just don't lock your knee out. And all you're gonna do, tap in front, back to the middle, tap to the side, back to the middle, tap back. Good. Again, if you fall out of it, just get right back into it. But again, yeah, round two, starting to feel that a little bit more on the outside of that hip. Again, level 1 exercises, we want to be challenging, but most importantly, we want them to be safe. It's about building confidence, right? So we want to build confidence in these movements, so when we progress you to level 2 will be easy or be doable. A lot of the stuff you might not be able to, in level 2, you might not be able to do right now, but the more you do this, the stronger you're going to feel. More confident you're going to feel. Good. Switch to the other side. Slight bend. Tap in front. And that's why I love strength training for solving pain, right? Is that a lot of times the limiting factor, the thing that limits people from doing whatever activity it is, it's not even the physical pain. It's that confidence, right? Well, I would go on that hike, but I just know that my knee is going to hurt. And that really sucks. So I'm just not going to do that hike. So that's why, one of the benefits of strength training, it's not just the pain aspect itself, but it is that confidence level. Hey, look I can do a minute of step-ups. As we get to level 4, I can do a minute of weighted lunges, But the only way to build that confidence is that step-by-step approach, where if you just start with level 4 stuff, you're gonna hurt yourself, and then that confidence drops back down, which is the opposite of what we want. All right, good. All right, next, back to our carries. So grab that medium weight. I'm gonna hold it right in front of you. Again, pretty easy with this one. Just make sure it's not one of these guys, that you're standing straight up, muscles are engaged, and then again, we're just marching in place. One thing I didn't mention, but I think it's good to know just in general, I like to work out barefoot. What it does is it forces those small intrinsic muscles of the foot and ankle to work a lot harder, where when we're in shoes, the shoes do most of the work. So I want to build my body as strong as it possibly can be. Just barefoot, make those muscles work. Might get me into my rant about orthotics, but that'll be another video. I'll spare you today. Good. Keep going. And done. All right. Next, back to our hip hinge. I'll show you a variation with weight so you can see it. It is going to be in our level 2 workout, but if you want to practice it, start light. Don't do anything crazy. What you're going to do is now weight's right in front, loose knees, weight pulls you straight down as you send those hips back, stopping when you feel that tension in the hamstrings. So again, what I mean by that is that I can go lower, but that's all rounding at my back, which is not what we want. We want to keep that spine nice and straight. So again, if you don't have a weight with this one, it's fine. In fact, if you really don't feel comfortable or know everything that there is to know about the hip hinge yet, just practice it without weight. I'll try to include a few links that kind of goes over the hip hinge a little more in depth. There's a lot for something as simple as this movement. There's a lot to think about, a lot of reasons why you might be having back pain or knee pain with that movement. Good. All right, back to our bench. Gonna do our box squat. Almost done. All right, reaching back, tapping, and down. So again, a lot of people with knee pain, maybe you're not quite ready for the box squat. The other thing you can do are sit to stands. Start seated. Again, try to press through the knees and just stand up. That's actually pretty common in a lot of people that we work with that have knee pain or arthritis. Things where even something as simple as this box squat can be difficult, and that's okay. You just start with the sit to stand. Nice work. 20 more seconds. Starting to breathe a little heavy. Again, definitely harder than round one. Funny how that works. All right, 5 more seconds. Again, slow and controlled on level 1. We want this to be safe, right? It's not how many you can crank out in a minute. Good. Okay, we're gonna finish on up with our step ups. So grab your bench, grab your blocks, foot on top, and press up through that top leg. So again, only things you gotta keep in mind here, we wanna be pressing up off of this leg, not toeing off the back leg, and we wanna be moving vertical. Our body moves in an up and down and not like this, side to side. So it's okay to line your foot up to the outside of your step. Doesn't need to be back. Sometimes that's what people do is they try to line up too far back. Good. If you wanted to make this one a little bit harder and you have access to weights, holding 2 weights, holding 1 weight works too. Just make sure it's going to be the same on each side. Good. But honestly, I mean, this is a nice little burn. And if you are feeling a little bit of pain, try to work through it. Maybe lower the step a little bit, but still try to do the movement. Good. Last one here, last minute. So remember that a lot of times your brain creates that sensation of pain because if you've been in pain for a long enough period of time, the tissue is healed, but the brain, for whatever reason, still thinks there's an injury down there and doesn't want you to use it. It goes back to that building confidence, right? We need to prove to the brain that you're able to do this movement. It's a weird concept. I know. The more you dive into pain science, it gets gets really crazy. Neuroanatomy and things like that. But trust me, it works. And again, this movement isn't one that's going to be doing any damage to your knee. So if you're feeling pain, really try to just kind of work through it. We're proving to our brain that you have the ability to do this. If you need to do a little bit lower step, that's fine too. And done. Nice work. All right. So that is the end of our strength training workout for knee pain, level 1. My name is Dr. Carl Baird. This is Performance Healthcare Online, where we solve pain with strength. If you have any questions about today's workout, leave a comment down below. And don't forget to subscribe. Thank you so much for watching. I look forward to connecting with you guys. Thanks so much.